For the acid-base balance, we need to remember that we have the blood that is slightly basic. We're talking about 7.35 to 7.45, so very limited range of movement. And to maintain it, we need a buffer. And if you remember, the buffer is a system that would maintain, will refuse or oppose changes in the pH. So for the buffer, if you remember, we said it's either weak acid or base that will either give or release hydrogen ions. So what does it mean when we say weak acid? Let's just try to understand the strong acid first. This is a strong acid, just like HCl. This is the strongest acid in nature. So when we dump HCl in a cup of water, we will see the release of hydrogen ions. So all of the hydrogen ions were released from the HCl. So if I drop 100 molecules of HCl, I will see 100 hydrogen ions in the cup. So it's a strong because it released all of its hydrogen ions. Weak acids don't release all of their hydrogen ions. This is the carbonic acid. We are familiar with it. If we drop it in a cup of water, I will see some of the hydrogen ions released, but also I will find that the carbonic acid did not completely dissociate. I will find some of the carbonic acids as well. So here, this acid, the carbonic acid, did not release all of its hydrogen ions. I still have hydrogen ions here. If it was strong, it means I will get a complete separation between the hydrogen ions and the bicarbonate. But since it's weak, no, it maintained that. And therefore, this weak acid will act as a buffer because I can move this system, the carbonic acid, in both directions. This system or this equation can move into this direction and therefore gives me hydrogen ion, and this is acid, and it can move in this direction and take the hydrogen ion, which is base. And that is the definition. If you remember, that's the definition of acid and base. Acid, by definition, gives hydrogen ions. Base takes hydrogen ions, right? So if we have the equation moving to release hydrogen ions, that is an acid. If it takes them, that is a base. Okay, so that is the main buffer system in our body. Now, changes in this equation will happen usually at the other side. Okay, would happen usually because of the CO2, which we saw in the respiratory system. I will remind you with this. We will go talk about it. But also there is now another end. We have this end that can also affect the hydrogen concentration. So think of this equation as two ends. This end is controlled by the kidneys and this end is controlled by the lungs. Why the lungs? Because they have control over CO2. Why the kidneys? Because they have control over the bicarbonate. Therefore, the pH balance or the acid-base balance in the body is a work of the lungs and the kidneys almost at the same time. So there is this like work between them. The kidneys will back up the lungs will back up the kidneys. Therefore, because of the two ends, and those two ends are controlled by two different organs, it means if we have problems here, then we will have problems here as well. And therefore, we need to differentiate whether the problem is coming from the lungs or it's coming from the kidneys. The problems are the same. We will have either acidosis or we will have alkalosis. Either increase in the pH, like here, increase pH, or decrease in the pH. If it's low pH, it's acidosis. If it's high pH, it's alkalosis. But since we have two ends, then we will have two different names for the problem. It's the kidney part, it is metabolism, metabolic acidosis or metabolic alkalosis. If it's the lungs, it's respiratory acidosis or alkalosis. And usually, we will go, if it's the lungs, it's respiratory. If it's not the lungs, it's metabolic, because it might be not only the kidney problem, it could be like the digestive system problem. Someone is vomiting. So if it's the lungs, it's respiratory. If it's not the lungs, then it's metabolic, whether it's the kidneys or not. Okay, so what is happening? We already talked about this when we have hyposecretion and, when we have hypoventilation and hyperventilation, right? Let's go back to the drawing. We said we have, in case of hypoventilation, it means we have low CO2 release or less CO2 release, and therefore high CO2 levels. And in this case, the equation would move into this direction. Why? Because I'm having high CO2 here, I need to move in this direction. And this will cause high hydrogen levels. And high hydrogen levels, it means a drop in the pH, and therefore this will be respiratory acidosis. Respiratory acidosis in hypoventilation. In hyperventilation, it's the opposite. It means more release of CO2, okay? Therefore, drop in CO2 levels, okay? So here I will have the equation moves in this direction, in the opposite direction. Why? Because I need to bring this up. So So if I'm bringing this up, it means I'm going to consume hydrogen ions. Therefore, I will have less hydrogen ion concentration. Therefore, I will have higher pH, and therefore I will have respiratory alkalosis. Okay? So as again, it's respiratory alkalosis or acidosis if it's related to the lungs. If it's not related to the lungs, it will be metabolic alkalosis or acidosis. Okay? So how do I know if it's related to the lungs or not? And this is critical. I need to check the ventilation pattern. If it's related to the lungs, then the hyperventilation should give me alkalosis. Hyperventilation should give me acidosis. Okay? But if it was metabolic, then the lungs will try to correct. How they will try to correct? By breathing. So in this case, lungs or breathing pattern doesn't match the pH. Okay? So if the breathing pattern doesn't match the pH, then it's metabolic. What do I mean? It means if I have hyperventilation, but the pH is low. Hyperventilation and the pH is low. Okay? Hyperventilation and low pH. I will trust the low pH. So this is acidosis. But I know the hyperventilation should give me alkalosis. Hyperventilation should give me alkalosis. But now the pH is acidosis. Therefore, the breathing pattern doesn't match with the acidosis, or it doesn't match with the pH. Therefore, in this case, it will be metabolic. Okay? So this is critical, that you'll always trust the pH, because sometimes the lungs, in this case, the lungs are trying to fix the low pH. It's low pH. Why? Because I'm having high hydrogen ion concentrations. So what the lungs are doing in hyperventilation, in this case, hyperventilation, the lungs are hyperventilating when it's acidosis. They are trying to remove CO2. They are trying to take out CO2, and therefore trying to move into this direction, and therefore consume the hydrogen ions. So you'll always trust the pH, and then you would look at the breathing pattern. Now for the metabolic, the kidney part is a little bit, I would say, more complicated than the lungs, because for the kidneys cannot reabsorb the bicarbonate. We said the kidneys control the other end of the equation here, and specifically they will control the bicarbonate. However, they cannot reabsorb the bicarbonate directly. Rather, they have to convert it to carbonic acid and then to CO2. Absorb the CO2, convert it back to bicarbonate, and take the bicarbonate to the blood. Again, the kidney tubules cannot reabsorb bicarbonate directly from urine. They have to convert it to CO2. How? By binding hydrogen ion. Give carbonic acid, then break the carbonic acid into water and CO2. Absorb the CO2, bring it back to carbonic acid, break it down to bicarbonate, and reabsorb the bicarbonate. Okay? And if the kidneys are reabsorbing the bicarbonate, they have to release the hydrogen ion. So the kidneys will either reabsorb bicarbonate, release hydrogen ions, or the opposite. If they want to absorb hydrogen ions, then it means they have to send bicarbonate out. So we'll flip this reaction. So the most important part of this is to understand that the bicarbonate absorption in kidneys mean hydrogen ions release. Okay? And it does make sense, because if you have high concentration of hydrogen ions, high concentration in the blood, if you have high concentration of hydrogen ions and you need to absorb those bicarbonate to consume them, then you will take some of them in the way, right? Because you want to reduce the hydrogen ion concentration. And in this case, you are reducing it, or the kidneys is reducing it by what? By bringing bicarbonate. But as it brings the bicarbonate, it takes some of them also and dump them in the urine. So this is like two steps, or two dual action for correcting the hydrogen ion concentrations. So in case of respiratory acidosis, of course, you understand changes in the pH will affect the proteins of the blood. So sometimes we will have emphysema, we will have pneumonia, all of those would result in acidosis. Alkalosis will, when we have, for example, panic attack, emotional upsets, all of those would cause respiratory alkalosis. Metabolic acidosis and alkalosis, usually we said, they are related to other problems in the body, whether it's digestive or it's urinary problems, and those need to be corrected as well to be able to correct the metabolic acidosis and alkalosis. Now, the issue is with either metabolic or respiratory acidosis alkalosis, it's not easy to fix. So patients will spend several days sometimes in the ICU unit in order to get their pH correct. Okay, so that's it for this chapter. Let me know if you have any questions.